Pressure ulcers. Pressure ulcers, also known as pressure sores or decubitus ulcers, are areas of localized skin and underlying tissue damage caused by prolonged pressure, shear, or friction. They most commonly develop over bony prominences in patients with limited mobility, such as those who are elderly, paralyzed, or acutely unwell. Peak incidence can occur at any age but are most common in patients who are immobile, particularly elderly patients, patients with neurological deficits, and patients in intensive care or post-operative settings. Symptoms: non-blanchable erythema, skin warmth or discoloration, localized pain or tenderness, swelling or edema, blistering or open wounds, necrotic tissue or purulent discharge, and systemic signs of infection in severe cases, for example fever and malaise. Risk assessment. All patients should be assessed for pressure ulcer risk, especially on admission to hospital. The Waterlow score is commonly used in the UK. It considers age and sex, body mass index (BMI), skin condition, nutrition and appetite, continence status, level of mobility, and additional risk factors, for example recent surgery, trauma, medication use, and neurological impairment. The risk stratification based on the Waterlow score: 10 to 14, at risk; 15 to 19, high risk; 20 or above, very high risk. Diagnosis. Diagnosis is clinical based on the presence of characteristic skin damage over a bony prominence in a patient with risk factors. Investigations are not usually required unless there is a diagnostic uncertainty or signs of systemic infection, for example blood cultures or wound swabs. Management. The primary aim is preventing progression and promoting healing. General principles: moist wound healing. Maintain a moist environment using hydrocolloid or hydrogel dressings. Avoid harsh soaps or antiseptics that may dry the wound. Pressure relief. Reposition the patient at least every 2 to 4 hours. Use pressure relieving aids such as cushions or specialist mattresses to reduce shear and friction. Wound care. Cleanse the ulcer regularly with appropriate non-cytotoxic solutions. Apply suitable dressings and monitor for signs of infection or necrosis. Surgical intervention. Surgical debridement may be necessary to remove necrotic tissue. Antibiotics. Consider systemic antibiotics if there is cellulitis, sepsis, or local signs of infection with systemic symptoms. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today